Good evening, everyone. My name is Dr. Vida Felicity, or Dr. K, as you may know me. I'm very pleased this evening to introduce our panel, our MPA Speaker Series event. It's entitled Community Impact Assessment, Measuring Outcomes and Tracking Performance. This evening, we have with us four wonderful speakers from the Rochester community who are experts in this, right? So we will be talking about outcomes and performance. Big thanks to the Department of Public Administration, faculty and staff of Rockford Downtown who helped put this event together. And so now I'd like to introduce our speakers this evening. We have with us Marjorie Allan, who has been contributing to research and evaluation into children's health for over 30 years. Her background includes child and adolescent psychiatry, adolescent medicine, community, pediatrics, and public health. At the heart, her efforts focus on collaboration with community partners who work with children, adolescents, and families with the goal of identifying solutions and improving community health and well-being for all children. Our next speaker, Maya Crane, is the Program Officer Equity at the Rochester Area Community Foundation. She supports funding opportunities focused on race, poverty, and education in Monroe and 7 other counties. Maya has a bachelor's in business from Russell Sage College and master's in strategic leadership from Roberts Wesleyan College. Maya is a Rochester native. We also have with us Dr. Ari Elliot, who worked for several years in the private sector before completing his master's degree in community mental health counseling and PhD in human development at the University of Rochester. As a postdoctoral associate in the Department of Psychiatry, he conducted and published research examining social and psychological influences on disease biomarkers and health outcomes over the life course, including the interplay of socioeconomic status, well-being, and childhood adversity. Ari currently serves as a research and evaluation associate at the Greater Rochester Health Foundation, leading efforts to utilize health data and research to inform foundation strategy and grant making, as well as coordinating evaluation and dissemination activity. We also have with us Deb Hanmer, who currently serves as the Initiative Director for the Greater Rochester Parent Leadership Training Institute, alongside her work as a public sector leadership consultant. Ms. Hanmer has driven programmatic change and innovation in organizations and communities across the Northeast. Ms. Hanmer has deep expertise in leadership development, social emotional learning, data-driven decision-making, multi-tiered systems of support, and parent-community engagement practices. Ms. Hanmer holds a Bachelor's of Arts in History from Dartmouth College, a Master's of Public Administration from the Maxwell School of Syracuse University, and a Master's in Educational Leadership from Cambridge College. Thank you all for being here today. When I was organizing this panel, I invited the speakers to think about a series of questions that are related to the use of logic models, community outcome measurement practices and challenges, as well as the use of outcomes in decision making. So I have also asked the speakers to reflect on different related themes that may be of interest to them, but it is going to be a 10-minute per speaker panel, which is probably a little unusual for us, or it's a new type of event that we put together this time. Each speaker will talk about these outcomes and performance tracking for about 10 minutes, and I'll be keeping time. And we will have time for questions afterwards. Once the event is over, feel free to stick around and talk to our speakers and others. So let's go the order that's listed in the program, and we will start with Marjorie Allan. Marjorie, the floor is yours.
Thank you all. It's a pleasure to be here this evening to talk about something that is so very important to me, and I hope it is also important to you or becomes so. Before I start talking about some of the pragmatic issues like how we use logic models and that type of thing, I want to give you a little bit of the context of Children's Institute, which is where I work. Children's Institute's been in the Rochester community for a fairly long time. It started 65 years ago as the Primary Mental Health Project, which was a school-based prevention program that used paraprofessionals to help kids who just needed a little bit of a boost So they weren't necessarily kids who were in need of intense mental health services. But the founder of that program was very committed to having evidence drive the work that was done. And as such, he's credited as the father of community psychology. And in his role as our founder and as the first director of the Primary Mental Health Project, he fervently adhered to applying rigorous standards to the creation and validation, as well as the dissemination of programs and practices that affect children and families. And that legacy is really the foundation on which all of the work that we've done since then has been built. At Children's Institute, we collaborate with many early care and education centers. We collaborate with school districts and healthcare settings and with other child-serving organizations, both in this region and throughout the country. We also work closely, obviously, with higher education and with professional organizations. And within our partnerships, we deliver program evaluation, planning, and design. We conduct assessment, and then also conduct the analyses that are associated. So we've really assembled quite a team over the years. For all new projects, we develop blueprints that help us to describe the goals, the activities, the deliverables, and the intended outcomes that we expect to achieve. And among those tools that we use are some of the things that you were asked to talk about tonight. So, for instance, we were asked how our organization uses logic models. And even though I don't have a power presentation, so I'm feeling very inhibited by that, this is an example of a logic model that I'm currently using that still, you can see the watermark, that's in draft form. And I actually did this solely for internal use, although I would expect that I could project it and use it to explain what it is we think we have going for us. So those are the inputs that we describe in our logic model, who the participants and what the resources are that are going to be used to try to have a project get rolling. And we use the logic model to really figure out if we have going into a project what we think we're going to need in order to achieve our goals. And we try to link the goals directly to specific activities that we have planned. And without doing that, as a program evaluator, I would feel somewhat lost in trying to determine, when we have all the good intentioned people and all the programs that are well-meaning, how it is we're actually planning to accomplish what it is we are setting out to do. Most of the logic models that we work with incorporate short, medium, and long-term outcomes. Longer-term approaches to the same level of program evaluation would also potentially look at the impact of the effects of these programs in the broader community. So using logic models along with theory of change models and skill maps gives us a structured way to ensure that we've identified all of the key stakeholders that we need. And ideally, we should be able to present something like this to almost any audience. And they should, even if they're unfamiliar with the work that we're doing, they should be able to follow literally the logic of what our goals are. We were asked how at Children's Institute we track community outcomes and how we're sure that we're actually meeting some of the goals that we set out. And as a lazy person, the first thing I do when I'm trying to determine community outcomes is I look to see what information is readily available that I don't actually have to collect. Data collection is costly and it's arduous, and it requires somebody to be there to provide the information. So I look to places like ACT Rochester, where we have a plethora of data that allows us not only to look at data at the moment, but also trends over time. And that's compiled by the Rochester Area Community Foundation. Many of you are probably already familiar with that. Children's Institute and the Center for Governmental Research, I know, also contribute to some of those data points. And then within Children's Institute, internally, we've been tracking community change through our Rochester Early Childhood Assessment Project, RECAP, which has about 20 years worth of data that we've assembled, looking at pre-kindergarten classrooms and their quality, and then the student outcomes that are associated with the quality of the classroom. That model of assessment and tracking, by the way, has now been adopted in a lot of other areas throughout the state. As we work with school districts in similar settings where data is regularly collected as part of their day-to-day practices, we try to create data sharing agreements with them that allow us to access information that they have at hand. This often requires us setting up de-identification of the data sources and having regulations that we're meeting so that we're not in violation of people's privacy, but it's another way that we can utilize data that we don't have to personally collect. Unfortunately, when we're using those third-party data sources, we don't have control over the accuracy and completeness of the data that we receive from secondary sources. So internally at Children's Institute, we incorporate validity checks and other verification procedures that help us to weed out some of the anomalous things that we might see, like a child having a body mass index over 80, or somebody whose height decreases over the year, and exclude those perhaps anomalous measurement errors. However, we try to catch those problems as early as possible so that we can go ahead and use this treasure trove of community and readily accessible data that's available. We also, though, do a lot of our own primary data collection, and in those situations, we're able to train and supervise the process and incorporate quality assurance controls so that we can make sure that the information we're gathering is up to our standards, and it's also minimally invasive to the people who are providing the data to us. So we don't ask questions that we don't want the answer to because it's not serving any need, and we don't try to burden parents and certainly children with having to respond to data questions that are going to inform whatever the project is they're associated with. Some of the outcomes that we track and monitor using readily available data is trends over time that affect broadly observed community health outcome markers. So, for instance, if we wanted to look at changes in obesity prevention, or that obesity prevention efforts have made, or if we wanted to look at the outcomes of a teen pregnancy prevention program, we rely on census level data, public health data, to try to extract the prevalence that we can find there. Some of the other questions that we were asked about were perhaps a little less applicable to Children's Institute, because rather than contracting with independent evaluators, we actually are the independent evaluators who are contracted by a lot of community-based organizations. That's one of the things that we build our reputation on, and we enjoy a very healthy relationship with the community, because community members and the parent organization know that we're going to be fair and as objective as possible with the way we collect, analyze, and summarize and interpret the data that we have. And the data sources and the outcomes that we acquire through our work are used to help us set priorities with our other community collaborators. People at Children's Institute sit around a lot of other tables. I recognize a lot of people either by face or by name in this room, and I certainly recognize most of the organizations that are represented, because at least somebody I work with closely at Children's Institute is participating in a project with one or more of you. And that's one of the ways that we're able to share the information that we get and ensure that we're integrating our knowledge as wisely as possible to collaboratively address the most pressing concerns of the community. So I hope that gives you some idea of how we make use of this.
Hello, again, my name is Maya Crane, and I am the Program Officer of Equity for the Rochester Area Community Foundation. The Rochester Area Community Foundation has been around since 1972, and right now we have two large goals. One is equity, and the other focuses on vitality. And the vitality action areas, successful aging, arts and culture, and historic preservation. And one of the things, we also have 5 initiatives. So we work with, and a lot of what Marjorie said, she works with several of our initiatives. So we have RACHA, which is the Greater Rochester After School Alliance. We have Act Rochester, that is run by Ann Johnson, and that focuses on community indicators and getting that data placed for those things in our 9-county region. We have Rochester Child that really focuses on the early childhood work that we're doing here in the city, in Monroe County as well. 5A, which focuses on our after school and supports 500 of our City of Rochester children. And then we have Renew, which focuses on the climate control and being able to really focus on the lead issue that we had in a lot of our City of Rochester homes. So those are our 5 initiatives. And so the question that I asked was, how do we utilize the logic model in our organization? So one of the ways that we utilize the logic model is really to help our grantees be able to kind of put together their thought process and what they're really asking for from us. A lot of times they come with these grand ideas and we just, we love it, want to hear it, but then we want to make sure that we understand what does the process look like? What does that look like? So on our website, we actually have our logic model, and I have copies if anyone wants one tonight for it, but it really breaks down, again, to Marjorie's point about the inputs, what type of strategies and activities you should be looking at when you talk about your project or your program. What are the outputs, what are the short-term and long-term outcomes, and then the overall impact. So as you're looking at this, what is the overall goal, and how is this helping to move the needle when it comes to education, poverty, race, and our community? One of the things that we have begun to do this year, and my colleague and I, that we actually have been facilitating grant writing classes for a lot of nonprofits. And what we have found is once we have gone through this versus just kind of giving it to them, is that this is very helpful. They're able to ask questions, they're able to kind of understand, okay, this is what the process looks like. And then they're able to actually fill out these grants a lot more effectively, efficiently, and be able to then use the same process for other funders in the community, the National Health Foundation, ESL, United Way, and things of that sort. So we really see this as a tool, not just internally, but really making sure that those who are looking for funding from us have something that they can actually be obtainable and can help them through the process. One of the things that we know is that we're not trying to make this process hard, and sometimes it can be very hard. And who has actually applied for a grant in here, but it can be cumbersome. So we hope that the logic model is able to kind of make it a little more efficient, for those grantees. The next question talks about how our community outcomes measured in your organization. So the Community Foundation really focuses on systemic change. And one of the things as a funder is we don't move the needle on some of these systemic changes. We fund those people to move the needle on these systemic changes. And we work closely, specifically in the equity work, we work closely with REGI, which is the Racial Equity Justice Initiative, that is run by Dr. Candace Lucas out of the St. Joseph Neighborhood Center. We work closely with MAPI, which is a Rochester Monroe Anti-Poverty Initiative, led by Dr. Leonard Brock. And then we work closely with Rock the Future, which is led by Jackie Campbell, and that focuses on our education. So through those 3 collective impact conveners, so that's what they are, we're able to say we align our goals with what their actual goals are to achieve a specific population level result. And then we use Act Rochester as that community indicator to see if we're moving in the right way. So if Act has said that we are increasing in our poverty, then we know we're not, right? And we kind of go back to the board with different our MAPI and the different conveners at that table and say, what are we doing to be able to make some changes to that? And so yes, again, as a funder, we should just work with other partners and align our work with that. One of the things, and I echo what Marjorie said, is the accuracy when you are collecting data from other individuals. And the other part for us specifically, and we look at this work too, and we work with those 3 collective impact conveners, is the transiency that we have in our community. So we could be they could be collecting data from ABC with these individuals, and all of a sudden they're on the side of town and not able to have accurate data. So that is one of the things that we definitely have to do. This is actually where the Children's Institute comes in to be able to make sure that it's accurate and that they can actually put a second eye to it for us. And one of the ways that we're able to track over community outcomes over time is internally, we look at our own metrics, right? So how long does it take us to get a check out to the community? I think that's the way that we can actually measure and say, this shouldn't take us 6 weeks to get folks paid once they have a grant. It should take us 2 weeks because we understand this money is needed to be able to do the work that they need to do. We're also able to continue to supply with research that then impacts the community. So for example, the hard facts report that we put out a couple of years ago really helped drive a conversation around race and poverty in our community and really start to get the wheels turning and really set the table for some of these collective impact meetings that we have right now. And one of the, we also look at, we want to be able to leverage the client voice in a way when it comes to decision making, specifically when we talk about how do we utilize the decision making for our organization, for the organizations that we actually give funding to. While we may not talk to every individual, we do a lot of site visits. We're definitely on the ground. I was talking to Steve earlier and I was telling him that I'm out of the house 8 to 12 nights a month in the community, and because it's important that we meet people where they are, and a lot of times that is after hours, a lot of times that is meeting them in their homes, at different community events, at the RMAP events, and making sure that we're hearing them and that they understand that we are taking that into consideration with whom we actually are funding, whom we actually are needing to continue to do some work on, and then it helps us to go back and make changes to our strategic plan. And I would actually echo the same thing with Marjorie about the last 2 questions. It really asked about the whole grant writing process and the evaluation. Again, we go to the Children's Institute for a lot of those things. The Rochester Child, our Rochester Child initiative works heavily with Marjorie and her team over there to make sure that we are in compliance, that we are asking the correct questions, and that we're getting the outcome and the impact that we need for our community.
Hello, everyone. My name is Ari Elliot. I want to thank VIVA and the Department of Public Administration for having me. It's an honor and privilege to be here, and particularly to be on a panel of such esteemed colleagues. I want to especially thank you for the introduction, because that's my least favorite part of speaking. So it's nice to not have to do that. But we have partnerships in different forms and have had at different times with all of the organizations that are represented at this table here, and then many in the audience as well. So I just want to start by just giving a little bit of context on our organization. The mission of the Greater Rochester Health Foundation is to pursue and invest in solutions that build a healthier region where all people can thrive. Happy to say that equity is now a central value within our organization. Recognizing that equity is not just a social justice issue and imperative, but is really central for us to be able to fulfill that mission. As we know, not all people are thriving due to the systemic issues and barriers that Maya spoke about, poverty and structural racism in particular, as well as access to healthcare and other resources. So I was sorry to miss the event that preceded this one, which I know was about poverty. So I'm not sure if it came up, but probably many of you saw the report from Common Ground Health that was released earlier this week on the link between poverty and health, showing that health inequity is responsible for more premature years of life lost than the next four largest contributors combined. And so, and it also has a cost, I think, that was estimated at over $1 billion. So when we seek to, thinking about the title of this event, Community Impact Assessment, when we think about and seek to have impact in the community, it's really to support and fund, but also advocate for projects and initiatives that improve health in communities and populations. Going forward, in particular, with a focus on improving health outcomes and reducing racial and other inequities in health that affect historically marginalized communities. And we recognize that we have a lot to learn in that space, which should be the whole space, right? When we're talking about equity. So when it comes to how we operationalize equity in our grant making, we are, as I mentioned, the Racial Equity and Justice Initiative. We are participating in that initiative, looking at our policies and practices to make sure that we are practicing racial equity within our organization, as well as in our external and our grant making. And so we're in a learning process, and I think we have a conversation with Maya coming up in the next week or so to pick her brain and learn from her expertise in that area. But in general, we fund grants to a variety of organizations for projects across a range of health issues and approaches, from improving quality and access to healthcare, to community-based prevention, as well as policy and advocacy work. We're also one of many organizations supporting collective impact initiatives in our community, as Maya spoke about, Rock the Future, RMAPI, and others that are working on addressing systemic inequities in opportunity. So getting to some specific questions, how do we utilize logic models? Often with the support of consultants or evaluators, such as Margie and others, we have developed logic models for our strategic initiatives. And they really provide, as others have spoken about, a framework to help us track our progress against our short-term and long-term outcomes. It also helps us to identify the appropriate metrics to assess our outcomes. And so I'll just give you a couple examples. One is what we call neighborhood health status improvement. That's an initiative that's been running for around 10 years. It's really an asset-based, resident-driven approach to changing neighborhood conditions in ways that further support the health of communities. And so I also have a logic model here that I could hold up, but I'm not sure that would be very informative. But just to give you, in a nutshell, the model is really that by changing sort of the social determinants of health, social, economic, and educational opportunities, that we can change sort of knowledge, attitudes, and behaviors related to health, as well as kind of community agency and cohesion that will support healthier practices and ultimately healthier outcomes. We also have a current strategy focused on children 0 to 8 and their families, called Healthy Futures. And we are actually in the midst of a process of refining that strategy to have a very more specific focus and scope, and also, again, to integrate an equity lens. So as part of that process, we will be revising working on our theory of change and logic model. So I will say that unlike the Community Foundation, we have not typically required nonprofits to kind of submit logic models as part of their grant applications, partly to reduce burden, but also because we want to be thoughtful and ensure that logic models are really the result of a thoughtful process of strategic planning, organization-wide or programmatic planning, and not something that the grant writer just needs to complete. And so I really very much appreciate the support that the Community Foundation offers to applicants in terms of helping them work through the development of a logic model, because I think it is a very helpful exercise. But we have also heard that for some of our applicants and partners, particularly smaller grassroots organizations, there's sometimes a perception that logic models are overly rigid, or some of the terminology may not be familiar to community partners. And so I just want to mention that there's a resource out there called the tier list logic model. When I first heard it, I thought it was TIR, and I was like, that's strange. It's like a logic model without a hierarchy, but it's actually like tier list, and it's not going to make you cry. And so it just takes some of the components of the logic model, the inputs, the outputs, and the outcomes, and has a series of questions that an organization or team can ask to help work through what those mean. And so, don't have time to mention some of those, but I think that we really can get a lot of insight by asking ourselves, by asking others some questions, some basic questions, as Margie alluded to, sort of what are your goals, through what strategies and activities are you going to achieve those goals, and then how are you going to measure success? And if you think through those questions and get really clear on those, then you essentially have the skeleton, at least, of the logic model that can be built out. So it's really making sure we're very clear about how the pieces are linked. And I think part of that is checking our assumptions. And so we recently were debriefing with some grantees who completed wonderful projects, but had to make some adjustments along the way. And when we look back on it, it was partly because there were some assumptions that were built into the program design that turned out not to be the case, right? So I think it can be an exercise in sort of checking our own assumptions. So how are community outcomes measured in our organization? As others have said, as a funder, we rarely collect data ourselves. We really rely on others, such as ACT Rochester and Common Ground Health, to provide the community level data that helps us to assess an issue and assess how that problem or issue is changing over time. And so we try to look at community data across multiple sources that help inform our assessment of what are the most pressing needs and priorities in the community. But I just want to echo what I think what Maya was saying, which is just that it's really, I think, and what we are learning as an organization, critical to balance and complement community outcomes data with community voice, and with hearing directly from the people who are affected by an issue and have the lived experience of that system's issue or barrier, and to ensure that they are really, their voice is part of helping us to prioritize the issues that we work on, and then to actually develop solutions. And so that's what we're doing as we go about this process of refining our Healthy Future strategy. We've we have a consultant who's doing focus groups out in the community with youth, with parents and families, with staff at nonprofit organizations, community leaders, and that's a more robust process than we've ever had in the past. So we are really appreciating the value and the rich insights that come from that. And then what we're doing is trying to look at the intersection of the insights and priorities that emerge in the community with the data, really looking at where those converge. And that's really where we will look to focus our efforts. So I think the community voice is important, and it can really help to get at the why. So that an impact assessment can show you kind of what works or whether an outcome changes, but why that is, right? What contributed to the change? Use intermediate outcome measures to try to get at that, but sometimes you really need that lived experience and voice to really kind of illuminate what is happening on the ground.
Okay, my name is Deb Hanmer. I'm the Initiative Director for the Greater Rochester Parent Leadership Training Institute. I am, I think, a little different from the rest of the panelists. I'm sort of in the practitioner bucket of this work, representing a nonprofit. So I'm going to try to tackle what types of challenges that organizations face in utilizing community impact, community outcomes. And then also talk about what I think is more exciting is how outcomes are used in decision-making, at least in our organization. So for context, the Greater Rochester Parent Leadership Training Institute is an organization that works with parents to develop their ability to be change agents in the community. We work with parents over the course of 21 weeks on things like public presentation and speaking skills, looking at budgets, analyzing data, using their personal stories, their stories from the heart about something that's either impacting their child or their neighborhood, and really using that and harnessing that with the kind of like intellectual skill, data, and kind of a narrative that other change makers listen to, right? So our idea is that we don't want parents in groups talking about problems that are impacting their children. We want them tackling those problems, understanding how systems work, how some systems are intentionally set up to be difficult and challenging, and how to learn to navigate those systems for their own child and everyone else's child, i.e. their community at large. So PLTI has been in Rochester since 2012. We're on our 7th cohort of parents. We have about 125 alumni who are citizens. They are folks who have been trained, who are out there working on different issues that impact their community. Again, a group that is focused on not talking about issues, but working with allies, working with others in their community to really kind of affect change. And the PLTI model is basically we bring an intentionally diverse group of individuals together. And when I say intentionally diverse, I mean the selection process is like, we want to make sure we have a balance of City of Rochester residents as well as folks who live in the suburbs. So our current cohort is composed of RCSD parents and families, West Arundecoit parents and families, Brighton, Pittsburgh, Hilton, right? Groups of people who would never be in a room together. We have young moms who didn't finish high school. We have PhDs. We have diversity of religion, all again intentionally. When you want to diversify, you intentionally go after that diversity. And that's what PLTI is about putting people in rooms who, especially in our community, there is kind of a narrative that permeates and discussions that happen in groups that are the same, right? And those conversations are about sometimes, especially disenfranchised Black and brown folks a lot of times, about what they care about and don't care about, and why kids are underperforming in schools, right? Why people are living in poverty. And it's sometimes connected to pinpointed moral failure, right? Versus the systematic understanding of how policies have been established, historical roadblocks to access certain things. So putting a group of different folks in a room together, building a community over 21 weeks, where it's like now I'm understanding and hearing about something from a person that I've never spoken to. I'm hearing about what it feels like to have my child in a school, and when I go up, people kind of move around very quickly. It's kind of hard for me to get an access and understanding of services that are going on. And I'm not used to that if I'm a person with a lot of privilege, right? I'm used to people listening to me, to meetings being taken. And sometimes I might roll my eyes when I hear about this because I don't have relationship with people who are different from me. And PLTI creates that intentionality, that relationship. And it's amazing to see that transformation that occurs individually for parents. Some parents who kind of are not the ones who are used to having power and access sit and learn about things that are about, again, systems, policies, and structures that are in place. So they say, oh, okay, the fact that I'm working 3 jobs, I'm struggling, I still can't seem to get ahead. Maybe this isn't because of, I'm not smart enough or I'm not good enough. Maybe it's not about that, right? And, we have people in the room who are used to power and access and privilege, right? We have a white male in the room who might have the first understanding that the reason they have the job they have is because their parents go to the same country club or went to college with the hiring manager and HR person, right? And that it's not just about their gifts and talents that they have, right? So those personal individual transformations that occur in that room together over the course of 21 weeks sets this group up to be more civically engaged, right? To be the people who go to the public hearings, who go to meetings, who speak up and are not afraid to kind of like speak truth to power. One of the things on the handout that you have is PLTI's theory of change. And this, I think, kind of gets into the first thing about measuring incomes for outcomes for organization, right? So this theory of change was developed among our national organization. We're part of a national network to really understand, like, why is parent leadership unique? What is unique about this idea of like parents becoming parent leaders versus other leadership kind of development organizations? And again, arguably, parents are the constituency that is most impacted and concerned about access to healthy food and eating in their neighborhoods, to what kind of recreational centers are in community, to things like speeding on a street, right? Like if I have small children and somebody's always racing them, that's a community issue. It's one that affects my child and everybody else's. So we wanted to understand what happens from a parent going through a course like this. So that theory of change kind of highlights, I think, in a very strong way. It's like I have this individual transformation where I'm learning about kind of how systems work with this other group. That gives me this agency, this belief that I can be in control of things that impact my life. And that ultimately leads to a more civically engaged parent. And what we wanted to understand, we wanted to be an organization, right, that is not just doing a set of things over and over, right, but an organization that says, okay, if out of this, our parents are more civically engaged, so what does that mean concretely? Like, how is that represented? And on the back of that handout is just like what that means concretely. Like, and as public administrators, I think we can appreciate that, right? Like those hearings, it's like going to vote. It's things that have an impact, being engaged at a different level in your community because you believe in, even though the system might be broken, you believe you can change the system, right? And that's what that civic engagement can look like for our families. But then beyond that, I think to the point that Ari brought up about the sort of lived experience of folks. So it's always good and it's always helpful, especially if you're running a grant, to have concrete outcomes and things to put in that grant, but we wanted to make sure, because parent leadership is so much about your voice being heard in your home, in your child's school, and in the community, that we did not leave that voice out in how we evaluate the impact of a parent leadership organization. So a number of years ago, about 3 years ago, our organization partnered with the Metropolitan Center for Research and Equity on equity and the transformation, this is a long title, and the transformation of schools at NYU, along with a company called Algorithm that supports nonprofits and outcome assessment, to help understand and really strengthen like why parent leadership was impactful, what's important in a way that kind of can value the voice of our parents who've gone through this process, right? And the work that they went through is something called, this is a new term to me, it might not be new to the others on the panel, but a participatory evaluation, right? So versus an evaluation where sometimes a group of outside people come in and meet with people that kind of don't look like them, don't talk like them, don't have a similar context as them. This participatory evaluation process is one that's made up of other parent leaders, of people from the community, right? Along with a team of researchers, right? To help give guidance, help kind of provide like some of the structure and capture some of the information. But in that way, sort of the way the evaluation is developed is like, here are trends and findings. And it's, if you flip through, I'm not trying to sell this book because we don't get any money for it. But if you flip through, there is a specific chapter on the Greater Rochester PLTI that kind of just outlines, and it was written by some of our parent leaders here, Jackie Campbell and a few others in the area who work with PLTI. That really outlines kind of like the trends and the findings. And what is exciting, and I'm getting the 1 minute part, so I'm gonna wrap it up. What is exciting about having kind of like this quantitative data that says like, here's why parent leadership is important and how it's impactful. And then having this qualitative, like here's parent voice information as a leader at a nonprofit, I can then say, okay, what are our strengths at PLTI, right? How can we really build on those, right? But then what's the next level? How can we really target the alumni who are now just citizens out there and really understand what they're interested and excited about, and continuing to help them make an impact in their communities. And that's where we kind of are with the outcomes. We want to be data driven to say that like what we understand about why we are successful, we continue to elevate. We want to not kind of like rest on the laurels to say, oh, you know, great, we've done a cohort, some people have graduated. What are they doing now to continue to have an impact in the community? Because ultimately, that's what we want to be about, things that impact children and families in Rochester.
Okay. Steve has a microphone. Anybody got any? Get the microphone.
Question?
Mainly for Deb. In the city school district, if you speak up as a child or a parent, Jada Williams, you'll be punished. And two of the teachers that I worked with in school, 52 spoke up, were punished. When I worked at Edison, who was chased out. Will there be enough individual parents at schools who speak out, risk having their kids? Jada was an A student who became a D student. Will there be enough cohorts, enough people together to speak out against the culture of fear and intimidation in the district and try to get things changed? How many cohorts will that take? Is that one of your desired outcomes?
So I think the question jumps out to me as like how does an organization like mine or other organizations that are kind of doing work around education and parent engagement kind of like affect change? We at PLTI are big believers in partnership and working with different school districts to kind of think about what is the best approach and route for development for teachers, for leaders. In a big bureaucracy, that is not easy work, but it is work that is starting. It's work that's starting. So I think there are many folks in the school district and individual schools and also the schools where like some engagement with parents and working to develop a culture and an environment that is respectful of parents, that welcomes parents, that recognizes that when you have empowered parents, you actually have the best kind of parents. And sometimes as school folks, and in another hat that I wear, like, as a former school leader, like sometimes that tension, it feels like, I gotta keep the parents back to kind of do what I need to do. So it's like just reimagining what that looks and feels like, what that parent partnership looks and feels like for school districts.
I'm just gonna put the microphone on that question. In your mind, ask it. All right, here we go.
This will be for any of the panelists that are actually providing grants. So I have a question in terms of diversity. As we continue trying to encourage diversity with organizations, what type of measures do you take to ensure that the nonprofits who are serving underprivileged or people who are from different diversity background are actually hiring staff or pursuing to hire staff who are actually diverse? Especially those who are not only working with a certain population, but actually the ones who are in management positions.
So for the Community Foundation for the last, I want to say maybe 4 years, we have been, part of the grant application is that we do a demographic survey. And what it does ask is what is the makeup of your organization, what is the makeup of your board? And one of the things we're doing right now in partnership with United Way is working with them to really start to aggregate this data. So to your point, we want to be very mindful, we want to be very much informed of who we are and supporting financially. And we don't want to penalize, but we do want to encourage and start to make some changes. The United Way offers several different affinity groups, ALDP, LLDP, where many organizations can find board members, many organizations can find individuals to be part of their organization. This is why for the Community Foundation, it's very, very important that we are actually on the ground and not just from this ivory tower that we can actually see. So that's very important to us. I also want to just say some kind of correct what Ari said about our logic model. We don't actually have it as part of our grant application because of the equity part of it. But one of the things that we realize is that many folks already know what their goals are. It's working backwards, right? So when you come to us for funding, you have these grand ideas, but we need to be able to say, okay, so what is the work and what does that look like? And for many people of color, that can be very hard. And because for whatever reason, they just be able to kind of organize their thoughts. So what we do is be able to use this as an option for you to kind of organize your thoughts. And this is how we are intentional about making sure that we are not just giving funding to those individuals who have access and resources, but I can sit down and I can talk. And I actually did this for the Beechwood Neighborhood Association, the Community Land Trust, not too long ago. And what they said was, this makes sense. This makes so much sense. But when you have sometimes it is jargon on a lot of grant applications, it doesn't. And again, I mean, world peace has been an impact for years, right? So if folks could logic model it that, maybe we could get there. But the thought is, this is just a tool for us to be able to say, for those who have different, or who don't have a lot of access to resources, and the Children's Institute, and Ari, and all of those things, say, we're here to help you and understand. We like what you're saying. Just make sure, we want to make sure that you're kind of backing all the I's and crossing.
Yeah, I'll just add quickly, thank you for clarifying my, and definitely looking forward to learning more about your process there. I'm going to be transparent and just say that that's something that we are working on. We need to improve in terms of our intentionality and our sort of explicit processes around how we assess who is receiving our funding and what the impact is. We know that organizations, smaller organizations, grassroots community-based organizations, organizations led by people of color, and particularly women of color, are disproportionately sort of excluded from funding. So we recognize the issue. We plan to look at collecting demographic information, and that's another area we would like to learn from you on. But we do ask questions in our grant applications about equity. We do ask about who will ultimately benefit from this project. And another thing, going back to the sort of community voice piece, is that it's not enough for us to kind of see the data and hear from an organization working on an issue that this is a problem. We ask, how do you know? Have you spoken to the people who are affected by this? And what have you learned? What have they told you about why this is important to them, and what solutions they think would be helpful and transformative? So it's really, we do have a process for kind of looking at some of the equity issues, but we need to get more intentional about that and to improve our practices.
We have one more question up here, but if you want to go ahead.
I was just going to briefly add that fundees who receive grant funding are responsive to this as well. For instance, Children's Institute, as part of our continuous improvement process, has engaged with Reggie, with Racial Equity Justice Initiative, and we are also recognizing that we have work to do in this area, and we know that to improve the quality of the work that we're doing as meetings and internally.
All right, get more questions ready. We have one more up here.
Good evening. I just wanted to kind of compliment, see your perspective in terms of this balance between the quantitative measures and constantly getting data and collecting data and having those numbers, and then also having the more qualitative information, recognizing, like you just said, how do you know, what have you learned, the participatory action. How do you kind of negotiate that balance?
As somebody whose background is mainly quantitative, I also recognize that data without context or data without heart is really not very useful to us. Just looking at the metrics, the outcomes that we think are going to tell us something about how somebody's actually feeling or how they're doing, whether or not they consider themselves to be thriving. Our metrics are indicators, which means they're proxies for reality. And as a statistician, I recognize too that we'll talk about knowing something statistically significant, and therefore we have evidence. Well, it's statistically significant because it lowers the probability that we're wrong. So the probability that we're wrong is always present. And being cognizant of that means that you're always doing a reality check. So you get your quantitative data and you say, well, this looks pretty good, you might know something. And then you go out into the world and you verify whether or not the numbers are actually replicated or mirrored in what you're seeing in people's experiences.
Yeah, I would say I would echo all of that, and then just say us, it's really kind of an iterative process. We can look at the data, outcomes, and particularly inequities, and have a sense of what what the issues are, whether it's food insecurity or rates of hypertension or whatever it may be, obesity rates. But then we need to go to community and really check that sort of assumption. Is this a priority in your community? And so we kind of learned that lesson the hard way. We had a strategy for 10 years focused on reducing obesity. And while when we say we, I'm really talking about all the partners in the initiative, of which there were many. Marjorie Allan Children's Institute were the evaluators and did wonderful work in difficult circumstances to collect the data that would actually allow us to track children's body mass index over time. And while we didn't see effects on a sort of school level ultimately or a community level, we did have a lot of positive sort of policy and practice changes. So that kind of speaks to the importance of having those intermediate and short-term outcomes, because some of these community level, kind of population level indicators are really have long horizons of change. So we need to have those shorter-term metrics to ensure that we're making progress. But again, with the example of obesity, is that a priority for families who are working multiple jobs or in poverty and are really focused on meeting basic needs and getting their children, child care or transportation, and may not really be focused on obesity, whereas from a public health mentality, we think that's such a critical outcome. And then at the same time, we need to check our assumptions. So going back to the poverty report, there was and this was from a survey, so this was hearing from community can be both quantitative and qualitative, but it was really around kind of healthy eating and looking at income and its relationship there. And so while we might assume that those with lower income are less interested in healthy eating, they actually had similar higher income individuals, I think over 75,000, and lower income individuals, household income over 25,000, had similar levels of interest in eating healthy, but there were, not surprisingly for lower income people, the affordability and time issues involved in that are required for healthy eating were really much more significant barriers. So again, just kind of going back to that balance of kind of qualitative and quantitative, and then complementing outcomes data with direct voice.
Other questions?
Yes. What area do you see the greatest deficit in the work that you do, and what are your plans to improve or change that?
I had a hard one lined up,
Let's see. I think deficit is just continuing to make sure that we are not simply celebrating kind of like that we're doing a thing, even if our thing, like our outcomes are about executing this cohort. And we don't see that as like good enough. That's not the purpose of an organization that's supposed to be impacting the community. So making sure that we're hitting those quantitative outcomes that are important, as well as kind of continuing to work with the community to make sure we're leading around issues that are impacting. So I think just making sure we're staying focused on the big picture impact and not just checking the box of metrics.
Yeah, and again, as a funder, we don't move the needle, so I think it's really important that we continue to align and partner with those organizations who are. We could solve poverty tomorrow and we would have another deficit, so it's really important that we, that's it, right? We So the thought of the matter is really make sure that we are doing the data tells us where we need to be, data tells us what the deficit is. The truth of the matter is, we could solve some of the issues of poverty in the city of Rochester, and we still have a lot of the surrounding counties that we have to, so it's kind of forever kind of going, but for us, it really is to make sure that we're partnering and collaborating with those who are all staying on top of it. And I think deficit is kind of fluid. What does that look like today versus tomorrow for us? And, so really being able to make sure that we can change our strategic plan quickly to be able to continue to impact and affect our community in a positive way.
All right, so we're gonna get everybody out by 6:45. Is it okay if I ask the last question, which is like 10 seconds each? So I think what we hear in this conversation is all the right things. And this is what you read in the research, this is what you hear in other communities, these are all the things that we should be doing and need to continue to be doing. But if you could comment, why is it you think that Rochester's poverty rate then is so much higher than many other places in the country? What is it that needs to be tackled that maybe isn't in all these best practices?
That's the 10-second question.
We can do a whole other round. We're just seeing interest for the next 10 seconds.
The one piece of input I'm going to put in is I think as far as PLTI is concerned, I think one of the things is that we don't have honest enough conversations across difference. Like, the elephant in the room of this community around race and how we talk about different things and closed door groups and how that impacts decision-making policy and things like that. So I think in some other regions and areas, those conversations are more open and there's more inclusive nature. My opinion, not PLTIs at the end.
So we have this whole thing called systemic racism that goes on in Rochester. And as a Black woman, and I need to say I am not talking from the Community Foundation standpoint, I'm talking from my Ukraine. I didn't put these systems in place. So until we actually, to Deb's point, can have these conversations with individuals who did, then we will continue to go through this on this hamster wheel. And this is the definition of crazy and insanity. The other part of this is we need folks to move back from these tables who are making these decisions. So those of us who can actually, and are impacted by it, can actually sit at these tables.
Amen. Yeah, no question. I think what comes to mind for me is that we collectively, recognizing that we are sort of service and kind of nonprofit rich here in Rochester, but then at the same time have such high rates of poverty and inequity, which is so deeply inextricably linked to structural racism, as we know. So we need to be focused on equity, and that's not only racial equity, but I think it starts there, and we're starting to really have those conversations on mobile in a more robust way, and actually starting to put collaboration and action to that. So we are intending and committing to doing our part in looking at ourselves and changing our practices. But I think we need to realize that, and this speaking to myself too, we can't program our way out of poverty. So we really need to look at the systems that perpetuate and keep poverty in place, and to change systems, we know we need to collaborate effectively across sectors and organizations. So we need to work better together. And again, just to echo the point that we need to have diverse voices at the table. And so we are partnering This is not 10 seconds, by the way. So I'm just going to say, real quick, just an example, we are partnering with PLTI and other parent leadership groups in the community to make sure that there is parent and community voice at collective impact and other community tables so that parents, families, and community members are informing solutions. And so we need to kind of build our that sort of civic engagement. I think that's the piece that's been missing too. We need to support kind of movements and power building within communities, so it's not top down and organizations trying to program.
I don't think there's a tremendous amount that I can add that would contribute beyond what we've heard. But I do think that Rochester is unique in that we have a lot of resources, and yet we've somehow crafted this self-sustaining situation of really deeply rooted poverty. And as has been noted, most of that is linked to structural racism and the history of racism that this city has demonstrated. And I think one of the ways that we're going to slowly emerge from that and is through having more and more individual organizations, funders, take the role of actively becoming anti-racist and how they approach the work that they do and the lives they lead.
All right, well, it is a tough task to get up here to that. We just have to ask for that. We also have a gift and a certificate for your participation. Sit up here and field questions you don't know that are coming. Thank you very much for your input, and let's give them another round of applause.
Okay, thank you for coming, and I also would like to ask for a round of applause for Steve Hanmer.
I will do that. Right.